cats are masters of disguise. They show no weakness, hide their pain, and often appear completely normal, even when something in their body has long since gone out of balance. This behavior is deeply rooted in their nature, because in the wild, anyone who shows signs of illness becomes easy prey. For us, however, this means that some serious illnesses go undetected until it's too late. And often, it is precisely the quiet, creeping illnesses that make life difficult for cats without anyone noticing. A typical example is chronic kidney disease. It is especially common in older cats and hardly noticeable before it reaches an advanced stage. Early signs such as increased thirst, frequent urination, or slightly dull fur are often overlooked or dismissed as age-related. But these very symptoms are important early warning signs. The kidneys deteriorate slowly, painlessly, but continuously. And because cats continue to eat or play normally, the disease often remains hidden for a long time. Overactive thyroid glands are also insidious. Many owners are even initially pleased when their older cat suddenly becomes more active, eats more, and seems to show youthful energy. But this behavior can be a sign of an overactive thyroid, a hormonal disorder that, in the long run, puts strain on the heart, throws the metabolism out of balance, and leads to weight loss despite a good appetite. If this goes unnoticed, the apparent vitality gradually turns into creeping exhaustion. Even more subtle is the onset of arthritis. Especially in indoor cats, it is often noticed far too late. The animals simply move less, jump onto furniture less often, and stay in one spot for longer periods. All things that are often considered to be due to comfort or age. But in reality, they are avoiding movements that cause them pain. Especially in overweight or older cats, arthritis develops quietly but steadily and significantly reduces their quality of life, often for years, without being detected. Dental diseases are another area that is frequently overlooked. Cats with inflammation in the mouth or loose teeth often continue to eat anyway. They simply chew differently, swallow more quickly, or avoid certain foods. They show hardly any pain reactions, but may simply become quieter or withdraw. But untreated dental diseases can lead to chronic inflammation that burdens the entire organism, even resulting in heart or kidney damage due to bacteria entering the body. Diabetes also initially progresses silently. The cat drinks more, urinates more frequently, eats more, and yet still loses weight. These signs are often recognized late or misinterpreted. But if blood sugar remains at a dangerous level for a long time, the risk of serious secondary diseases such as nerve damage or infections increases dramatically. A particularly insidious opponent is also hypertrophic cardiomyopathy, a heart disease that often occurs in younger cats, especially in certain breeds. It causes no visible symptoms for a long time. The cat appears healthy, eats, plays, sleeps, until suddenly shortness of breath, weakness, or even a collapse occurs. Often by then it is already critical. Because there are no early warning signs, the disease is usually only discovered by chance during a routine examination, if at all. Even parasites like Giardia or worms can go unnoticed for a long time. Slightly altered stool consistency, occasional vomiting, or a dull coat are signs that are easily overlooked. But the burden caused by parasites weakens the immune system, disrupts digestion, and can cause serious problems, especially in young or senior cats. Do you also know the reasons why cats die suddenly? In the video I've linked for you here, I'll tell you all about it. Go ahead and watch it right away.